Welcome to Summarize Science, where we break down the latest research for you. Today, we're looking at a fascinating development in healthcare, robots that can handle one of the most common but delicate nursing tasks, changing a wound dressing. Chronic wounds, from things like diabetes or pressure sores, affect over 6.5 million people in the U.S. alone, costing more than $25 billion annually. This care is almost always done by hand by trained professionals, but there's a growing shortage of nursing staff. So, a team of researchers is developing an autonomous framework to help automate this critical process. Their work focuses on one of the trickiest parts, manipulating the adhesive medical tape. This might sound simple, but for a robot, it's incredibly complex. The first major challenge is what they call tape initial detachment, or TID. Imagine trying to peel a sticker that's completely flat against a surface with no edge to grab. That's what the robot has to do. To solve this, the researchers didn't just program a set of movements. Instead, they used a technique called imitation learning, where a human expert guides the robot through the task. Using a special haptic controller, an operator could feel the forces the robot was experiencing, allowing them to teach it the right amount of pressure to scratch and gently lift the tape's edge. The second challenge is applying new tape correctly. The tape needs to be placed smoothly over curved body parts, like a leg or a heel, without any wrinkles, to make sure the dressing is secure. For this, the team developed a numerical optimization method. The system first creates a 3D map of the body part. Then, it calculates the perfect path for the robot arms to follow, applying the tape with just the right tension to ensure it conforms perfectly to the skin surface. So, how well did these systems perform in testing? The imitation learning method for peeling tape was a huge success, outperforming a standard motion planning approach. It was not only more effective at lifting the tape, but it did so while applying significantly less force, making it much safer for potential patients. The tape placement system was also incredibly effective. On anatomical models of a leg, hip, and heel, the robot achieved nearly 100% smooth coverage, a vast improvement over simpler control methods. The researchers even demonstrated the entire pipeline, from removing an old dressing to preparing and placing a new one. So let's recap the key points. Researchers have developed two new robotic skills, one that learns from humans how to gently start peeling medical tape, and another that uses smart planning to apply new tape perfectly onto curved surfaces. This is a massive step towards creating robots that can safely and reliably assist with wound redressing. In the future, this technology could help ease the burden on nurses and family caregivers, lower healthcare costs, and improve the quality of life for millions of patients. Of course, there's still more work to be done before these robots are in our homes, like automating the cleaning of the wound itself. But this research establishes an essential foundation for the future of robotic wound care. Thanks for watching Summarize Science.